In this video, I'd like to answer the questions: when and where shall I perform newborn hearing screening? If we look to the guidance from the Joint Committee on Infant Hearing in 2019, the document states, infants should have their hearing screened as close to discharge as practicable, while at the same time allowing sufficient time for a single repeat screen to be performed if the infant does not pass the first screen. The second screen, should it be required, should not be performed immediately following the first screen, but should occur at least 7 hours later. Let's break down that statement in a little bit more detail. The key points to extract are that screening should occur as close to discharge as possible. Firstly, this implies a hospital-based screening program, and we'll learn that not all screening programs have to happen in the hospital. The second key point to note from this statement is the fact that we need to factor in a rescreen should the patient be referred on the first screen. Now, this second screen cannot occur immediately after, but needs to occur several hours after the first screen. Therefore, the decision on when and where to perform the newborn hearing screen is not as simple as you might think. If we look at hospital-based screening programs, which form the majority of screening programs around the world, we can see that children are being discharged from hospitals more quickly, and this poses a problem because finding time to complete multiple screening stages can be a challenge in these situations. We also need to be aware of loss to follow-up and achieve a screening program where this is avoided at all costs. One route which the UK has explored is the option of offering two screening methods. The first is a hospital-based screening method, but also a second option is to perform screening based in the community. A study was performed looking at health visitors in the UK who visit the baby at home. In this situation, the health visitor will perform the otoacoustic emission screening, and the results from the study showed that this is a valid approach, and therefore the UK either applies hospital-based screening or community-based screening. In addition to being able to be performed at the child's home, a second study in South Africa looked at the possibility of performing newborn hearing screening in vaccination centres. They found that motivation to attend these vaccination centres, of course, was high, and therefore this provided a better environment to perform newborn hearing screening. They also found that in these situations, performing an automated ABR as opposed to an otoacoustic emission test provided the best results with regards to referral rates. So screening can be provided across a variety of different settings, and a one-size-fits-all approach to where screening should be performed should be avoided. Instead, we should focus on where we're going to get the best possible results, the lowest referral rates, and lowest loss to follow-up, depending on the infrastructure of the country where screening is being performed. The next question we need to ask is, when should the newborn hearing screening be performed? As the position statement identifies, children can refer on their first screen. This is because of the presence of fluid in the ears immediately following birth. A study in 2014, which focused on otoacoustic emission testing, looked at the effect of different protocols and timings of the screening to see if this can improve referral rates. Here we can see the results from 6 studies which they analysed. As we can see, multiple OAE steps have been performed in each of the studies, and the number in brackets denotes the number of days age of the child at which screening was performed. We can see that if newborn hearing screening is performed very close to birth, then referral rates occur higher, whereas if screening is performed later and at multiple steps, then we can reduce that referral rate down. So again, we're always trying to fight the balance of identifying the optimum time to perform the newborn hearing screen whilst at the same time ensuring that we are performing it in an environment where loss to follow-up is going to be minimised. The pooled results from this study, which took all research papers together, showed that if you perform newborn hearing screening using otoacoustic emissions before 2 days of age, then the referral rate was 13.8%. But if you increase this over 2 days, then this reduced the referral rate to 4.7%. So leaving the screen later, over 2 days, results in much better outcomes with regards to referral rates. However, depending on the country you are in, the child might be in very different places 2 days after birth. Some might be at home, some still might be at hospital, and therefore the decision on where the screening takes place should take into consideration the effect of the time at which the screen will be performed after birth. So in summary, when should we perform newborn hearing screening? Well, we need to leave it long enough for the temporary middle ear fluid to dissipate, whilst at the same time balancing this up alongside your follow-up strategy. We have seen that leaving it 2 days after birth has much better referral rate than screening within the 2 rates using the otoacoustic emission method. Then secondly, where should newborn hearing screening be performed? Well, in this case, we need to perform newborn hearing screening where maximum coverage can be achieved with properly trained staff which fits within the health and social systems within your country. More importantly, if we're waiting 2 days in order to perform the newborn hearing screen, then it's important to know where the child is at that point in time in order to choose where would be the best possible place to perform the newborn hearing screen.